All right, we'll go ahead and get started. Thank you guys for being here for our COVID-19 media availability for the vaccine. On the docket today, we'll have James English, COVID-19 response operations chief, and as well as Renown will have an update. I just had a couple quick things. I posted in the chat today's press release regarding individuals 16 plus with underlying health conditions now being eligible. Those vaccines will be administered by pharmacies in the regional or in the federal pharmacy program. The other update was to the COVID-19 dashboard. We put it down last week just to kind of help with some maintenance accuracy issues, just to make sure that when we have cases that were declared out of jurisdiction, that we could better populate those, like when they were out of jurisdiction, so that the most accurate numbers were being updated on dates that were already happened. Other than that, I'll head it off to James English. James actually, I caught him in his office. He had heard complaints that his screen wasn't exactly level. So he stuck Post-it notes in his laptop to kind of lift up one side, and actually had a leveler to make sure that his screen was perfectly level for you guys. So I just want to applaud him on his dedication for this meeting. James, if you're ready to go, please go ahead.
Thanks, Scott. Yes, I'm learning a lot with all these media briefings and this response. On Thursday, we ran a second dose pod, and with that, we did almost 1,000 vaccinations. And also, as the Washoe County Health District here at the RLEC, we surpassed 31,000 second dose vaccinations. So that was a huge milestone. On Saturday, our pod operation set a new record with over 2,600 vaccinations administered over the course of the day. And that also placed Washoe County Health District at the RLEC with more than 75,000 total doses administered to date. Yesterday, we administered another 1,178 doses. That was of the Janssen vaccine. So those individuals are also fully vaccinated at this point in time. With today's vaccine delivery, which we have already gotten our allotment shipped to us for the entire week, it puts the Washoe County Health District in excess of 104,000 total doses received here, the Washoe County Health District, to use at our location. Furthermore, we were able to add 300 additional vaccine slots to this Friday's pod. We were able to do that with some additional vaccine we had, and also the fact we continue to see no-shows in our first dose pods. So we're utilizing that on Friday, which is a high demand day for vaccine. It doesn't matter which day of the week we open or when we open, but Friday is always the first day to fill. Washoe County in general is operating in the essential workforce lane in the frontline commerce and service industries, and we're inviting the hospitality workers, the food service workers, and our resort properties. The retail pharmacy program is targeting those 16 and over with underlying health conditions at this time in our community. And furthermore, I just want to remind everyone that almost all the pods within Washoe County are all done by appointment, both here at the RLEC with our fire partners and with Renown Health, CHA, and many of the other pop-up pods that happen in our community. They're all by appointment only. We had quite a few people show up this weekend without appointments, hoping to get a vaccination, and that is not the case. And finally, on the Washoe County Health District RLEC vaccination pod, pleased to announce that we have gone out to bid for our new location. We'll be moving back to the west side of the RLEC grounds. Many of you will know that is where we ran our testing all summer and into the early fall. So we are working on that, and it will be fully operational there by May 18th. With that, that's the end of my report for today.
Thank you, James. I'll now pass it along to Melody Osborne from Renown Health.
Good morning. So Renown has completed more than 45,000 dose 1 and dose 2 vaccinations to date, which includes our Tier 1A medical staff members, as well as our Renown Health employees, students, volunteers, and seniors in our community. We are working to distribute the initially available limited supplies of the COVID vaccines allotted to us. This week, the Washoe County residents who are 55 years and older with underlying health conditions, as well as those who are 65 years and older, are eligible to receive a ticket to schedule through MyChart to schedule the vaccine. We're also excited to announce that we're working on an easier way to schedule appointments through MyChart and look forward to providing that update to you soon. The plan for next week is to begin distributing vaccine to Washoe County residents who are 45 years and older with underlying conditions. As we receive additional vaccines from the county, we hope to provide additional appointment slots to our community. Any updates to our vaccine plan will be updated on our covid.renown.org vaccine site. And again, those who are eligible for the vaccine will receive notifications through their MyChart account. And those are the updates that I have for today. Thank you.
All right, thank you very much, Melody, for that. We'll open it up for questions for both James and Melody. So we did get a couple questions from KRNV. Unfortunately, a lot of the questions here are regarding the 16 and older with underlying health conditions population, which the pharmacies in Washoe County are helping with administer vaccines to that group. And those are questions that they provided were more for the state, but there was one saying that many people are still unable to schedule their vaccine for months out, even if there is eligibility. Any advice or tips for them to actually get through? Melody, is there any tips you have on there, or James, feel free to chime in on that one.
Yeah, I can go ahead and take that from Renown standpoint. Anyone in the community who meets the age criteria and is having a difficult time scheduling a vaccine, I would encourage them to reach out to our Customer Engagement Center. That phone number is 982-2871, and we can certainly provide some assistance with getting that scheduled.
And Scott, I also see that Miss Candace McDaniel is on today's media briefing with State Immunization Program as the bureau chief, and I think she would have some information to help assist with that question.
Yeah, hi. Thank you, Mr. English. So it's Candace McDaniel from the Nevada State Immunization Program. And so as our pharmacies continue to make those appointments available for this population, just really want to promote and support that the allocation is shipped week by week, right? So the months out, I think it's really important to just continue to check that nvcovidfighter.org website for the availability for Washoe County with the pharmacies. So as they continue to receive that federal allocation of vaccine, they'll continue to update their appointments. But as with every other occupational group or even the general population group, from the beginning of this response, we've never gotten enough allocation in a week's time to reach everyone in that group or that population. So continued patience, continue to check back on the website. And especially as we move through April, as additional allocation is received from the federal government, additional appointments will be able to be opened. Thank you.
Thank you very much, Candace. I have a couple other questions here regarding just kind of the pharmacy program. Do you want to take those now, or would you like me to send those to you offline and we can work with KRNB?
I can take them right now.
So first one is, will you need a doctor's note to register for the vaccine to show that you have a qualifying underlying health condition?
Right. So our pharmacy partners will promote like a screening process about age and occupation and things and underlying health conditions. But there is no that proof of like a prescription or things like that. And really what we promote, especially for this population of individuals with underlying health conditions, if they have clinical questions about any of the medications they might be on or their particular condition, that those clinicians are available for that feedback. But there's no paper proof that will be requested, but there is a screening process.
Okay, thank you for that. And then a couple more here. It sounds, you might have already answered this. What's the best way to fully determine your underlying health condition does in fact qualify you for the vaccine under this eligibility group?
Right, yeah. So we did publish a technical bulletin that outlined the underlying health conditions that the Centers for Disease Control and Prevention categorized in 2 different areas. So really, they're both at risk, just different variations of risk. And so that technical bulletin can be found through the NV Health Response website and even looking through nvcovidfighter.org. We are promoting through Immunize Nevada another sort of a condensed version of that that's being translated now that will be available on the NV COVID Fighter page as well. And as always, if there's any questions or a condition that someone has that may not be on those lists from the CDC, to have that conversation with their healthcare provider.
Perfect. And then as of this morning, some of the pharmacy partners like Walgreens and Safeway websites still weren't showing eligibility for 16 plus with underlying health conditions. Any insight on that, or when will they have an update?
Yeah, so it's definitely pharmacy by pharmacy, but they are receiving their federal allocation, their shipment today and tomorrow. And so I would just check back either throughout this afternoon or tomorrow for the availability.
Perfect. Yeah, and I saw that Walmart and CVS already had the possibility for you to check that box for 16 plus with underlying health conditions. And then I think this is the last one. It might be for James as well. If you're under 18, do you need parental consent, or does your parent guardian have to be with you for the vaccine?
Right. So definitely for those children that are 16 and 17, they're only able to get the Pfizer product because that was the only one within the clinical trials that included that age group. So in terms of the parental consent, yes, they do need parental or custodial consent to be able to be vaccinated. That person can be with them. I think it just varies company by company about what that looks like in terms of documentation. But we, try to put as much transparent information on nvcovidfighter.org, and we'll continue to update that page for information just like this.
All right, perfect. Thank you for that. That was all the questions from floor. I see Valentina has her hand up. Do you have a question, Valentina?
Yeah, quick question. We've been checking since last week for appointments at pharmacies, and I'm sorry if you have already answered this, but we are not able to find any appointments at pharmacies. Were those doses for the 16 and older population, are they going to be available this week in Northern Nevada or only in Clark County?
So this is Candace McDaniel. They will be available this week for Washoe County. But as we just said, it's continue to check their websites for the availability. Sometimes there's a lag in updating the appointments to when it goes live, but all of the pharmacies statewide are vaccinating this group this week.
And if I can just add on to that, that's why Washoe County Health District will continue to operate their pod in the essential workforce lane, because we are also seeing a higher demand than we have vaccine allotment for. So we do not want the essential workforce group also trying to get the same vaccine allotments out of the retail pharmacies. We're doing our best to continue to vaccinate them as quickly as possible. But if you look at our calendar right now, we completely filled this week's slots, except for the additional ones we just opened this morning for Friday. And we are actually scheduling next Monday and Tuesday. And as those start to fill, we will open our schedule up most likely tomorrow afternoon. But we are seeing a much larger demand for vaccine over the last 2 weeks than we have seen recently. And that is primarily because of the new workforce we're in our hospitality and food service workers.
It's Valentina again. Do you know how many doses will be available at pharmacies for that population this week?
All right, so this is Candace McDaniel. for the Nevada State Immunization Program at DPVH. If you don't mind actually submitting that request to the NV Health Response email, be happy to answer that for you.
So we did ask on Friday how many doses would be available, and they said that about 25,000 doses would be available, but they didn't say where. Is that for the whole state for 1 week, or for what's the timeline for that?
Thank you, Valentina. This is Candace McDaniel. I don't have that in front of me, so I would just say if you could please just submit the question with detail. If it's specific to Washoe County, we'll be happy to answer that.
Hey, James, this is Scott Sonner at Associated Press. There was concern a while back that perhaps people wouldn't be choosing to get the vaccine, and a lot of people kind of were going to wait and see how, as we went into different groups, if that was the case. Is this a sign that, are you surprised or just pleased, I guess, that there's such a demand for the shots right now?
I am extremely pleased with the high demand of vaccinations in our community right now. And I think part of that goes to the large numbers of our positive cases were attributed primarily to people that either visited grocery stores, restaurants, or their place of work as the top 3 locations where they remembered going when we did disease investigations. I believe our restaurant industry fully knows, along with our hospitality industry, fully understands that if we want to get our economy going and our tourism going and to keep their employees safe and healthy, they need to promote the vaccinations. Over the weekend, we saw a very diverse group of individuals coming through our pods, from seniors through utility workers, through communications workers, hospitality workers, hotel workers, and restaurant workers. So yes, the uptake has slowed some, but I think now that we're into this group, it has picked up quite a bit, and we are monitoring that closely. We're also working with the Gaming Control Board and with the Restaurant Association to help assist in getting the messaging out that we are in these groups for vaccinations.
Hey, Candace, one more question. For that 16 and older population, were appointments available last week, or they're starting today and tomorrow?
So for the 16 and older population, that's starting this week. So, we had today's date as the start date, and that's because we have variability across the state, and because it was a statewide step with this group. It will vary, obviously, pharmacy by pharmacy, but it's this week.
Any other questions?
Yes. Is there just a general message we could from the county to anyone that falls into this age range that just finds himself frustrated that they're unable to get the vaccine at the moment?
The general message from our regional response, and also I believe from state immunizations, is to please continue to be patient. The supply of vaccine is still not meeting the demand. We fully hope within the next few weeks that we will start closing that gap as the supply chain opens up. There seems to be some understanding that Merck, who's begun producing the Janssen vaccine, may be able to start delivering that in the coming weeks. And with that, I think you'll see a larger availability throughout the region and throughout the state, and we can vaccinate more. But right now, everyone needs to continue to be patient and not get frustrated with any of the workers in either the state call centers, Renown's call center, or the health districts. And then continue to check the websites. We'll continue these twice a week briefings and try to give as much information as possible. We're still seeing a static to slightly increased amount of vaccine in our community. We also know some medical providers are receiving it for the first time this week. So everyone needs to work with their medical providers and continue to check all the websites for the most up-to-date information. So the big one from the state, the big one also for everyone to remember is that they go to the NV COVID Fighter website. So that is a huge one, which our website links to, but that will have all the up-to-date information. The health district provides all the regional pod information we have to that group so that there is consistent messaging and everyone knows where vaccines available.
Any other questions? Okay, one last update I had from the communication side. The Wednesday media briefings with Kevin Dick will be canceled moving forward. We're gonna still have the Monday and Thursday media availabilities, and Kevin will be a part of the Thursday ones as well as James when he's available. But as we kind of go into this, we're going to stick with 2 media availabilities, Monday and Thursdays at 11. And also once we start getting into April and May, we're going to get other members of the COVID-19 response team on to discuss when local control starts on May 1st. So we'll have subject matter experts on that topic as well. That's all we got. If you have anything further, please feel free to reach out to me. And otherwise, have a great day. And thank you all to our guests, and especially Candace, who was not, she came on the fly. So it was really nice to have you on. So thank you, Candace, for making yourself available.
Yeah, thank you.
Thank you all.